Well, a crisis is brewing across the state and the country when it comes to caring for our animals.
Like so many industries, the veterinary workforce is experiencing a major shortage. Tonight, Danny Spiewak looks at why and what's being done to help.
She's got beautiful teeth.
As one of two veterinarians on staff at Modern Love Veterinary in the North Loop,
Good job.
Dr. Justine Jones doesn't have much free time.
I like staying busy, so busy days are kind of fun.
But it's been more hectic than usual since COVID.
A lot of people adopted dogs during the pandemic. They had a lot more time at home, a lot more flexibility. Certainly there are days where we have to say no to pets, which is always hard. If we have a full schedule and we just don't have the capacity to see them, we'll have to send them to the emergency room.
The ER is typically a much more expensive option.
We always try to accommodate, but that does happen.
In the first year of COVID, 23 million American households adopted new pets. At the same time, roughly 500 regions across 46 states are reporting shortages in veterinarians, according to the USDA, including 15 areas in Minnesota.
There's an increased demand for veterinary services across the profession.
Dr. Laura Mogard is Dean of the University of Minnesota College of Veterinary Medicine.
This workforce shortage is not limited to any one particular geographic area or to any particular species. So we are still seeing increased wait times, especially for emergency services.
The shortage is felt even more deeply in rural areas. You might recall the story of Dr. Robert Bogan, the last remaining veterinarian in Faribault County, who gave away his clinic for free in 2022. Well, it turns out the beneficiary of that clinic left only a few months later.
The impact of the veterinary workforce shortage really does threaten the health of not only animals but people. Obviously, many people eat meat, and meat comes from animals. There are diseases that are shared between people and animals.
As the only veterinary school in the state and one of roughly 30 nationwide,
we're going to start with small animal case 1.
The University of Minnesota plays a major role in tackling the shortage.
The reason we decided not to choose it is because it's a third-tier antibiotic.
To put more veterinarians in the workforce, the U of M boosted class of 2025 enrollment from 105 to 125 students through a partnership with South Dakota State. The U's veterinary school also has a program that specifically trains and mentors students who want to work with food animals.
And that's been very successful.
However, the cost of veterinary school can be a barrier. The average graduate in 2022 carried roughly $150,000 in debt, although federal and state programs offer some assistance.
Loan repayment programs are really important. Student debt is a big challenge for this profession.
The American Veterinary Medical Association is pushing for federal legislation that would ease the tax burden on a loan program for graduates who practice in underserved areas.
We could increase the number of veterinarians who are helped and could go to rural areas by 25%.
Veterinarians in metro areas like Modern Love in Minneapolis say they need broader assistance too.
That would be wonderful, or if education costs were more manageable, because right now that's probably the biggest burden, along with work-life balance.
Dr. Jones launched her career during COVID after graduating from the U of M Veterinary College in 2020.
I'm kind of used to the heavy demand, but I know that isn't the norm, and that has been a shift since 2020.
Still, she wouldn't trade this life
All right, you did so good.
for anything.
I love my job. It's doable, and it's a position I really like, so I would encourage people to still do it.
There's also a shortage right now of veterinary technicians. They are essential, handling duties ranging from blood draws to x-rays, but Minnesota is one of just 9 states in the U.S. that does not license them. The Minnesota Veterinary Medical Association is asking the state legislature to change that next session, saying that licensing could keep veterinary technicians in the field for longer. Back to you.